Essential guide for patients. This presentation provides critical information for adults with type 2 diabetes who are using or considering Mounjaro, Tirzepatide. We'll cover what it is, how to use it safely, potential risks, and practical advice to help you manage your treatment effectively. What is Mounjaro and how does it work? Mounjaro is a once-weekly injectable medication approved for adults with type 2 diabetes to improve blood glucose control, support weight management in qualifying patients. It functions as a dual GIP and GLP-1 receptor agonist, mimicking natural hormones that regulate glucose metabolism. This unique mechanism enhances insulin secretion when blood sugar is elevated, reduces glucagon production, slows gastric emptying, and decreases appetite. Administration. Using your quick pen correctly. Establish a routine. Select a specific day of the week for your injection and maintain this schedule consistently. Marking your calendar or setting a mobile reminder can prevent missed doses. Prepare for injection. Thoroughly wash hands with soap and water. Select an appropriate injection site. Abdomen. Staying 2 inches away from navel, upper thigh, or back of upper arm, with assistance. Clean the chosen area with an alcohol wipe. Administer properly. Remove the pen cap, press firmly against skin until you hear a click, and hold in place for a full 10 seconds. Proper technique ensures complete dose delivery. Safe disposal. Always dispose of used pens in a sharp container. Never place used needles in household rubbish. Your local council or pharmacy can provide guidance on proper disposal. Remember to rotate injection sites weekly to prevent lipodystrophy, changes in fat tissue, that could affect medication absorption. Critical safety warnings. Who should exercise caution? Mounjaro is contraindicated for patients with personal or family history of medullary thyroid carcinoma, MTC. Multiple endocrine neoplasia syndrome type 2, MEN 2. Prior serious hypersensitivity reactions to Tirzepatide. Inform your GP or diabetes specialist immediately if you have a history of pancreatitis, severe gastrointestinal disease, or kidney impairment. These conditions may increase your risk of adverse reactions and require close monitoring or dosage adjustments. Special population concerns. Pregnancy and breastfeeding. Mounjaro is not recommended during pregnancy or whilst breastfeeding. Animal studies have shown potential risks to developing fetuses. If you become pregnant or plan to conceive, contact your healthcare provider immediately to discuss alternative diabetes management strategies. Women of childbearing age should use reliable contraception while taking Mounjaro. Renal impairment. Patients with kidney disease require careful monitoring. Dehydration from gastrointestinal side effects may worsen kidney function. Your doctor may need to adjust dosing or recommend alternative treatments if you have moderate to severe renal impairment. Other medications. Do not use Mounjaro alongside other GLP-1 receptor agonists or insulin secretagogues without medical supervision. Common side effects. What to expect. Gastrointestinal issues. Most patients experience some degree of nausea, 43%, diarrhea, 21%, or constipation, 17%, during the first 4 to 8 weeks of treatment. These symptoms typically diminish over time as your body adjusts to the medication. Appetite changes. Decreased appetite is an expected effect and contributes to the weight management benefits. However, this should not lead to severe caloric restriction. Maintain regular, balanced meals even if portion sizes decrease. Injection site reactions. Redness, swelling, or itching at injection sites may occur. These reactions are typically mild and transient. Proper rotation of injection sites can minimize these effects. Keep your diabetes care team informed about persistent or troublesome side effects. Dosage adjustments or supportive treatments may help manage these issues effectively. Recognizing serious adverse reactions. Pancreatitis. Seek immediate medical attention if you experience severe, persistent abdominal pain that may radiate to your back, accompanied by vomiting. These symptoms could indicate acute pancreatitis, a rare but serious condition. Hypersensitivity reactions. Call 911 if you develop facial swelling, difficulty breathing, rapid heartbeat, or severe rash after injection. These could indicate a life-threatening allergic reaction requiring emergency care. Gallbladder problems. Report symptoms such as upper abdominal pain, fever, yellowing of skin, eyes, or clay-colored stools to your doctor promptly, as these may indicate gallbladder disease. Whilst serious side effects are uncommon, recognizing warning signs and acting quickly can prevent complications. Always carry medical identification indicating you use Mounjaro. Proper storage and handling. Temperature control. Store unused quick pens in the refrigerator between 2 degrees Celsius and 8 degrees Celsius. Never freeze the medication or use it if it has been frozen. Once removed from refrigeration, pens remain stable at room temperature, below 30 degrees Celsius, for up to 21 days. Light protection. Keep Mounjaro in its original packaging to protect from light exposure. Direct sunlight or strong artificial light can degrade the medication and reduce its effectiveness. Safety precautions. Store all medication out of reach of children and pets. Never share your Mounjaro pen with anyone else, even if the needle has been changed, as this poses serious infection risks. Before each use, check that the liquid in the pen is clear, colorless to slightly yellow, and free of particles. Do not use if the solution appears cloudy, discolored, or contains visible particles. Maximizing treatment success. Regular monitoring. Check blood glucose levels as directed by your healthcare team. Keep a detailed log of readings, noting patterns and triggers. This data helps your doctor optimize your treatment plan. Dietary management. Work with a registered dietitian to develop a personalized meal plan. Focus on complex carbohydrates, lean proteins, and healthy fats. Consistent meal timing helps stabilize blood glucose levels. Physical activity. Aim for at least 150 minutes of moderate intensity exercise weekly, as recommended by the NHS. Even short walks after meals can significantly improve glucose control. Regular follow-up. Attend all scheduled appointments with your diabetes care team. These visits are crucial for monitoring your response to Mounjaro and making necessary adjustments. Key takeaways. Using Mounjaro safely. Consistency is crucial. Administer your injection on the same day each week and follow proper technique. Establish a routine that works with your lifestyle to maintain steady medication levels. Comprehensive approach works best. Mounjaro is most effective when combined with appropriate dietary choices, regular physical activity, and consistent glucose monitoring. Your commitment to these lifestyle factors significantly impacts treatment success. Monitor and report side effects. While mild gastrointestinal symptoms are common initially, severe or persistent symptoms require medical attention. Never ignore warning signs of serious complications. Stay connected with healthcare providers. Your diabetes care team is your most valuable resource. Maintain open communication about your experience with Mounjaro and don't hesitate to ask questions or report concerns. Remember, while Mounjaro can be an effective tool in managing type 2 diabetes, it works best as part of a comprehensive treatment strategy. Your active participation in your care plan is essential for achieving optimal results.